This lecture is about the immune system. First, let's start with some basic words to describe the immune system and various immune responses. The lymphatic system consists of the lymph, the lymphatic vessels, the lymphatic tissues, and the red bone marrow. The primary lymphatic organs are the red bone marrow and the thymus gland. They are called primary because they produce B and T cells. The secondary lymphatic organs and tissues are the spleen, the 5 tonsils, the pious patches, the lymph vessels and lymph nodes, the skin, and the liver. Rheumatoid arthritis. It's a chronic systemic inflammatory disorder that may affect many tissues and organs, but principally attacks flexible joints. Systemic lupus erythematosus affects skin, joints, kidneys, brain, and other organs. Celiac is a condition that damages the lining of the small intestine and prevents it from absorbing parts of food that are important for staying healthy. The damage is due to a reaction to eating gluten. Type 1 diabetes or juvenile onset diabetes is a chronic metabolic disorder that adversely affects the body's ability to manufacture and use insulin. Pernicious anemia is marked by a decrease in red blood cells caused by inability to absorb vitamin B12. Vitiligo is characterized by white patches on the skin caused by loss of pigment. Psoriasis. It's a skin condition that causes redness and irritation, as well as thick, flaky, silver-white patches. Inflammatory bowel diseases is a group of inflammatory diseases of the colon and small intestine. Hashimoto's is characterized by an inflammation of the thyroid gland. Addison's disease results from adrenal hormone insufficiency. Graves' disease is an autoimmune disease where the thyroid gland is overactive, producing an excessive amount of thyroid hormones. With Guillain-Barré, the immune system attacks the nerves controlling the muscles in the legs and sometimes the arms and upper body. Weakness results, which can sometimes be very severe. Now we're going to focus on history taking and more precisely on the questions you should ask a patient if you suspect an autoimmune condition. Let's start with your patient's weight. Your question is going to be, have you lost weight recently or have you gained weight recently? Fatigue. Do you feel more tired than usual? If you need to ask about fever, do you have a fever? Have you checked your temperature? You may want to know if your patient has edema, in which case your question is going to be, have you noticed any swelling? Abscess. Have you noticed any lumps? If you need to ask about pain, do you have pains in your hands? Do you have pains in your feet? Diarrhea. How are your bowels? Have you noticed any change in your bowel habits? Allergies. Do you have allergies? Are you allergic to anything? Rash. Have you noticed any rash? Motor. Do you have difficulty walking, swallowing, speaking? Mood. Do you feel more nervous or anxious than usual? Sleeping habits. Do you sleep well at night? Do you oversleep? Now, let's have a look at the main diagnostic tools and treatment options. First, let's name autoantibody tests. They will look for specific antibodies to the tissues. Antinuclear antibody tests will look for antinuclear antibodies. Complete blood count will measure the numbers of red and white cells in the blood. Elevated CRP is an indication of inflammation. Erythrocyte sedimentation rate will indirectly measure how much inflammation there is. Let's have a look at the treatment options. Strategies for treating depend on the type of immunodeficiency disorder. Being treated regularly with immune globulin, antibodies obtained from the blood of people with normal immune system, given intravenously or under the skin. Stem cell transplantation can correct some immunodeficiency disorders. Hormone replacement therapy, anti-inflammatory medication, immunosuppressive medication, and physical therapy might help. Thank you for your attention.